everybody. Happy Friday out there. I'm Randy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department, here to give you our daily update on the effect of the COVID-19 pandemic on Mobile County residents. So let's get started with some of the data. Today we're reporting 3,295 cases of COVID-19 in Mobile County residents. 52 cases were added yesterday. This is just slightly higher than the day before and a little bit higher than we normally would see on a daily basis. I expect when we look back at this week on Monday, we will realize that this is a record number of cases reported in any one week in Mobile County or the state of Alabama since we began counting cases and recognizing cases in mid-March. So we have 286 patients who have been hospitalized at some point in their illness. That has ticked up a little bit in the last couple of days. 137 have died, and around 58% are presumed recovered. So again, we will look at how we fared this week on Monday, but I fear the way the trends are going, this will probably end up being the week with the highest number of cases reported since we began collecting that information in March. So I just have a couple of announcements to make, and then we'll have a few questions from Facebook and the media. But before I get started, yesterday I offended probably many people by referring to concerned citizens who were reporting violations of the Safer at Home order as a tattletale or a snitch, and I certainly did not mean to offend anyone in using those words that are descriptive but are offensive to many. So going forward, I apologize for that, and going forward I will try to use synonyms like informant or source or witness or observer to describe those situations. However, I do want to say that yesterday was the first day that publicly we provided the information that anyone who was concerned about a business or a restaurant or a facility violating the Safer at Home order, that they could contact us by sending an email to iscomplaints@mchd.org. And since yesterday, we've received 25 complaints. We usually get a couple a week, and so I'm really happy that talking about that yesterday provided an outlet for people to let us know when you see that the Safer at Home order is not being followed. Not all of the complaints filed with us are valid. Some people think that masks are required to be worn by businesses, for example, and that's not true unless it's a restaurant. And then for restaurant workers, it's only the ones that are interfacing directly with members of the public, customers. But we are taking those complaints seriously, and we will make every effort to reach out to a business that you let us know when you let us know that they are not following the Safer at Home order. But I need you to tell me the business name, the location, the street address, and then if you can, the telephone number, and that would greatly assist us in contacting them. Oh, and again, the sort of date and time that you were there and maybe observe those things. So again, thank you to the 25 people who took the time to let us know that there were businesses out there that were not following that Safer at Home order. Let's see, a couple of questions. Someone wrote to say, just a comment that Florida is suspending on-site consumption of alcohol at bars today. Should Alabama do the same? There are lots of possibilities on the table as we continue to watch our numbers rise. You can expect over the next months and maybe even years that we may go in and out of restrictions based on the amount of transmission in our community. So at this point in time today, there's everyone is still talking about mandatory mask orders. You might have noticed that there will be no fireworks display in the city of Mobile this year to try to keep crowds from gathering. So you will continue to see some restrictions, but those sort of large decisions about statewide bans on certain things are made in Montgomery with consultation with local leaders. If someone tests negative but has COVID symptoms, should they still quarantine for 14 days and retest? You know, the PCR test for COVID is pretty accurate. And in general, if you test negative, if you have symptoms, we would would more suspect that you have symptoms caused by another agent that causes respiratory disease and maybe not COVID. We rely on those tests pretty well, but it would not hurt to get tested again maybe 5 to 7 days later if you are just certain that you have COVID disease. But usually if you have symptoms and a negative test result, that means that your symptoms are caused by another agent, and there are a myriad of viruses out there that can cause upper respiratory symptoms. Also, asthma, allergies, other things that can cause symptoms very similar to COVID. Current hospital status or capacity, we have ample ICU beds and plenty of ventilators available to be used in our local hospitals. And then lots of questions about Commissioner Mackey and Dr. Harris's press conference today at 10 o'clock about the advice, the 50-page document that has been made available to the public for reopening schools. And we are just seeing that for the first time too. So I won't be able to provide a lot of comment on that right now because it just became available today. However, the Mobile County Health Department will be forming teams to work with pre-K through 12 school systems trying to reopen, and then a group of people who will be available to consult with colleges and universities. Question from Facebook about a mandatory mask regulation. We hear from both sides of this debate every day. Many people saying that wearing a mask violates their civil liberties, and many begging us to please mandate the order because they would like to feel like they could go out of their house and not be fearful of contracting coronavirus. One comment about about some fraudulent information that is out there. You have seen some cards or some flyers or infographics on Facebook and on social media about a card that says that I have an underlying condition, and due to the American Disabilities Act, I'm not required to wear a face mask because I would, release my protected health information to you. So the ADA and the Department of Justice published a COVID-19 alert about fraudulent face mask flyers. Department of Justice has been made aware of postings or flyers on the internet regarding the American with Disabilities Act and the use of face masks due to COVID-19 pandemic, many of which include the Department of Justice seal. These postings were not issued by the department and are not endorsed by the department. The department urges the public not to rely on the information contained in these postings and to visit ada.gov for ADA information issued by the department. So just wanted to comment on the fraudulent printing of those materials. Let's see, is it strange that the numbers are climbing after reopening and people refusing to wear masks? It's not at all. I mean, we expected that with the lifting of restrictions and more people moving about the community that we would see increased transmission, and that's exactly what we're seeing. Something about a rumor that doctors in Italy did some autopsy on people who died with COVID and said that it's a bacteria. No, the COVID is a virus. Now, when people die with COVID illness, they may have secondary infections that are caused by bacteria, but COVID, SARS-CoV-2 is the virus that causes COVID-19. Is it true even non-symptomatic people are having lung damage? I've not seen a scientific study on that, but if you have, please put it in our Facebook comment and I'll take a look at that. Once you have had COVID-19, can you get it again? This is something that the science is still out on. Scientists are very eager and interested to learn more about the antibody response that is mounted due to a COVID infection. How strongly the immune system responds, how protective those immune cells may be, and then how long may they last. And we just don't know yet if a antibody response or an immune response to an initial infection will protect you from a second infection. It may have to do with things like how long has it been since you were exposed or infected, how much viral dose did you get, that sort of thing. Let's see. Someone asking about the virus containing properties that sort of like bacteria strains, the numbers didn't just even out after warm weather. No, they opened states again, but I'm believing it should have leveled out. Viruses thrive in cold, bacteria in heat. Yeah, so generally we do see an increase of bacterial diseases in the summer and more viral diseases in the winter, but this is not always true. During pandemic H1N1, that influenza virus also showed up in an atypical time. It was at the end of traditional flu season, and then we had cases all through the summer. So I think that this novel coronavirus is showing us again that yes, we can learn from similar viruses, but it doesn't tell the whole story, and we have to learn from what we're dealing with from right now. Here's a question about people who need testing but don't have symptoms. When you call, they question symptoms and you can't get treated. So here's the thing. We're not going to ask you about symptoms at the Mobile County Health Department. So if you want to get tested and someone at another clinic is telling you that you can't get tested because you have symptoms, then call 690-8889 and we will test you at no cost to you. Oh, and then somebody corrected me on Facebook that the Alabama State School Superintendent is Eric Mackey, Commissioner Eric Mackey, not Bob Mackey, the clothes designer. So yeah, that was wrong as soon as it spilled out of my mouth. So thank you for correcting me on that. Let's see, another couple of things just to mention, and then I have two non-COVID things to talk about today. Today, the Alabama Department of Public Health released some information that the U.S. Centers for Disease Control has been deployed to Montgomery to help Alabama respond to COVID-19. So they're taking a look at things like clusters, community transmission, looking at the way we code death data, how our surveillance system is working, all designed to try to help improve surveillance, investigation, outbreak data management, visualization, all of that. We're very grateful to our federal partners to send a team of epidemiologists, data analysts, risk communicators, informatics, and visualization specialists. So welcome to Alabama. We're very happy that you're here to help us combat COVID-19. So a couple of things that have nothing to do with COVID. So there are going to be some rabies clinics in the month of July 2020. It's very important that you continue to get your pets vaccinated against rabies. On July 10th, that's a Friday, at the Mobile County Animal Shelter on Howells Ferry Road from 10 a.m. to 12 p.m. July 11th, on a Saturday, Pet Supply Plus from 10 to 12. And then one or two others later in the month, but I wanted to let you know ahead of time of those that are week after next, July 10th and July 11th. So go ahead and plan to get your dog vaccinated at these drive-through clinics. This is a great way to get the much needed vaccination and distance yourself from people by staying in your car and letting the veterinarian come to your car to vaccinate your dog. All right, last thing. I'm wearing red today because tomorrow is National HIV Testing Day. So it's encouraged to, we want to encourage people to get tested to learn of their HIV status. The 2020 theme is knowing, focuses on knowing one's HIV status, highlights new ways to be tested for HIV, emphasizes that we can continue the momentum toward ending the HIV epidemic, a plan for America. So the Mobile County Health Department and Family Health and our Primary Care Division were participating in HIV Testing Day. Today, we have at our downtown location, at our Women's Center and our North Mobile Center, we have been offering free HIV rapid testing at no charge, so free, at those three clinics. And again, just to remind you that tomorrow is National HIV Testing Day. Please know your status to prevent further transmission of this very serious virus. So with that, I will end today's update, and I will be here on Monday to tell you what happened with us this week with regard to the numbers. But again, I strongly believe this is going to be our highest week since we began, and the way that you can help slow the spread is to wear your face covering, cover your cough, wash your hands frequently, stay at home if you're sick, and keep a 6-foot distance between you and people who are not in your immediate household, which means if they do not sleep in your house at night, then maintain a 6-foot distance. So please, again, do your part to help us protect yourself and our community members, and we'll talk to you on Monday.